Let's talk about COVID again. We need to. The rise in COVID hospitalizations as frontline workers really struggling to keep up with demand. So now they are finding other ways to staff hospitals. Rachel Robinson has this story.
Local hospitals are working to keep up with the high demand of patients, and it hasn't been easy.
Say that we are, in a staffing crisis here as we face another surge of COVID infections.
And in times like these, they need to call in some extra help.
We have 57 contract nurses, traveling nurses in the facility right now.
Contract nurses and traveling nurses are registered nurses who come and help out when hospitals need it. But the problem is they're needed everywhere else, too.
When travel nurse requests are up about 400% or 4 to 1, then you're obviously going to get less and less from what you request because everybody else needs those nurses too. Couple that with the fact that travel nurses can obviously request a lot of money.
And with nurses being more expensive, hospital budgets can take a hit.
These nurses will be paid upwards of 2 to 3 times more than what we pay for a full-time staff equivalent.
But when there's too many patients and not enough nurses, hospitals don't really have a choice. And it's every hospital for itself.
It is now up to each individual hospital to compete for these resources. Ultimately, we're all working to fill our spots. Every single hospital across the state right now is suffering from a shortage in staff.
Hospitals aren't being helped by FEMA or the state and are expected to find these nurses and pay for them themselves, or use city or county American Rescue Plan Act funds. And the agencies that are supplying these nurses are also seeing a demand.
We are seeing the needs, and so we are continuously hiring nurses.
And until hospitals calm down, they will continue to need extra help. Rachel Robinson, News West 9.